I got down at 10 o'clock last night, so we're,
What did you have going till 10 o'clock?
well, no, the county council met, and then I'd write it, and then, okay.
Nope. I had
It's on
a thing in Fort Wayne.
Oh, yeah. I bet you're ready for the weekend.
my Saturday off.
All right. Good to see everybody. We'll start here in 1 minute, Apple time. Oh, just changed. Morning. Welcome to the Board of Works meeting. Friday, October 15th. We'll start with Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you, and let the minutes reflect that Board of Works member Jeff Gross is absent today.
Got it.
I suppose it's excused, but I'll let you decide that one.
Okay.
All right. So, George, we've got the Board of Works minutes from October 1st. Did you see anything that was maybe inaccurate or needs changed?
I did not see a thing.
Okay,
So if you didn't, I'll make a motion that we approve the minutes from our last meeting.
all right. I will second that. All in favor say aye. Aye.
Aye.
Those opposed? All right, thank you. All right, let's dive right into new business. I'm frozen up here. Hang on. There we go. All right, got a street closure request from Celebrating Us, 1 Warsaw. Travis, I don't see him. I think this is kind of a postponed event. They canceled their fall event due to COVID, and it looks like they're pushing it to, April 30th, 2022. So
Nope.
this would be pretty much the same road closure.
They didn't answer the insurance question. Can you read that?
It says can if needed,
Can if needed.
Oh, yeah.
can get if needed.
Yeah.
Boy, I can't believe you can even read that.
And then also, he did say that they're gonna close it, following the morning market, but I don't think the farmer's market will be, going on until the next Saturday, because doesn't it start May 1st? Or like the first Saturday in May to the last Saturday? in
I think you're right, you're right.
So, he might not have a problem with that. He could set up at 10 o'clock in the morning. if he wanted to.
Just looking through here. Okay, Center Street between Lake and Buffalo. All right.
We've done this before.
Yep,
several
yep.
years now. I'll make a motion to approve the street closing.
All right, I'll second that. Further discussion? All in favor say aye. Aye.
Aye.
Those opposed? All right. Our Community Economic Development Director, Jeremy, will present the pay app for engineering on Anchorage Road.
Yeah, this is pay application 24 in the amount of $20,351.19. It's just a typical PE pay application as we continue the final engineering on Anchorage Road. We're also in the right-of-way acquisition phase, so moving the project along. Hopefully, we'll be able to bid this out next year for a construction in 2023.
All right,
I'll move to approve.
I'll second that. Any further discussion? All in favor say aye. Aye. Those opposed? All right. Again, as a reminder, this is 20% for the city, 80% reimbursed.
Yep.
So, all right. And then also Buffalo Street Plaza, pay app 15.
This is the final pay application for the Buffalo Street project. You have payment in $15,300, which is a change order. This will also go before the redevelopment commission since it's coming out of redevelopment allocation, but this is the last change order for this project. Overall, we were under, as reported previously, by about $381,000, but this would be the final pay application for that project.
Okay. Just a quick question. I noticed that, so this work has been done. The filter's been installed. I assume, though, obviously, the splash pad's been closed for the summer, so it's still working. have you had any indication how that second filter's working?
We've ran that for about 2 or 3 weeks now, and it seems to have helped a ton. I mean, there might just be a little bit of rust, but it's been over weeks instead of days. So I think it's really helped the situation.
Okay, great.
I think it has helped. I mean, we're still getting some, so we're going to explore what other options we might have. I'm curious if the longer we run it, if that will, I'm wondering how much was in the system, maybe cleaning out the filters, so we're still working on it, but it did help a lot. I mean, it cut it down probably by 90%.
Yeah, good.
That's good.
All right, well, appreciate that. So any other questions on that,
No,
George?
I'll move to approve the pay app.
Okay, I will second that. Any further discussion? All in favor, say aye.
Aye.
Those opposed? All right, thanks, Jeremy. Chief Wilson, this would be the Comcast contract for Station 3, approved by the Fire Territory Board. Station 3 does not have access to Metronet, so we have to go rogue in this one instance with Comcast cable.
As you see, there's just a slight increase between the last 3 years and the proposed.
So this is primarily phones and internet?
Yes, sir, it is.
Okay, all right.
Fairly important.
Yes, it is.
I'll move to approve.
I will second that. Any further discussion? All in favor, say aye. Aye. Those opposed? All right. You've got an IPEP grant here. This is an 80/20 grant, kind of initiated through HR, and it's in the amount of $6,915, 20% of that to match. Any comments on that?
This is joint training, OSHA training that Aaron Bollinger will go receive if we are awarded for scaffolding and for fall protection. This joint training is for all city employees. He works with wastewater, with Public Works, and with Parks Department to give them their training. You're going to see that in the next month he's going to be doing their 10-hour. The rest of this is a rescue tripod for our technical rescue team that would be available to be used with our city employees and departments also.
All right, and it appears that this grant, this is the second go-around on this grant.
Yes, it is.
How much, do you remember last year we received from this grant?
We only applied for the rescue equipment last year, and we did not get it.
Okay, great.
Hopefully we will. I'll move to approve.
All right, I'll second that. Hang on just a sec. So this is for application. We have not been awarded, correct?
That is correct. We have not. This
All
is
right.
coming to you for permission, as it did with the territory board.
Permission to
Yeah.
participate.
And it will come back to you if we get,
Okay.
if we get wording that we're going to be
Got
awarded
it.
it for
All right,
permission
just
to
clear,
receive.
make sure we all understand that. All right. Any questions?
No? All in favor?
Say aye. Aye. Those opposed? All right, thank you. Chris, you gonna come up and talk about pretty exciting program?
Yeah, so we're asking permission of the board. This did go through the territory board already, but we have our CARES program that we've started. We've been getting busier and busier. It's a great program. It's community outreach. We're helping people who, as I like to say, aren't being served by the system that we have in place. The mayor asked us to add mental health into kind of a resource allocation program. It's going really well, but one of the questions we have is how do we financially sustain this program? So what we found is that the state of Indiana has actually started certifying EMS and fire departments with mobile integrated healthcare is what they're calling it. If we get certified in this, and it's really kind of blends in with what we're already doing, we'd be able to then in turn bill for some of our services, not necessarily to the individuals, but to Medicare, Medicaid, insurance possibly. There are some programs that have been out there for a while. They're still kind of feeling their way through this process. This is something new, to bill for a service from fire and EMS where you're not being transported. So they're trying to find their way through this process, but getting certified would certainly be the start of us getting into that mix and figuring out how that works. The idea would be that we would work with the local hospitals, do some extension care for some of their patients. So what we're asking really is permission to meet with them and see about setting up agreements with both Parkview and KCH. And it would certainly involve some of the local physicians as well. And get that certification through the state of Indiana with those agreements in place. And then we could start doing more for folks out in the community, and we could try to get some financial reimbursement for our time and efforts along the way. So certainly if we have any offers of agreements from the hospitals and it's going to be a contractual situation, that will come back to you for your permission to do those things. Certainly we'll look at those pretty in depth at the time, but for now we're just asking your permission to pursue those options.
What state agency is this FSSA?
It's through FSSA. It's
Right.
the State EMS Commission is where this is kind of housed right now, but they are working really closely with other agencies to try to make this work. I think what they're seeing is the incredible burden on the ERs and the healthcare system, and they're trying to lessen that burden. The federal government tried to start a program, actually has started a program with EMS, where if they transport a patient to, say, a ReadyMed or an urgent care center or MedStat, they could seek reimbursement for that, and that's never been the case. It's always been you go to the ER if you want to get paid. And now they realize that we're overburdening some of these hospitals and some of the situations, and so they're looking for alternative options here, and this is one of those options. We just want permission to pursue this and to see if we can bring this to the fire department, because we feel like we have the staff, we have the want and the knowledge to do this, and it'd be a good extension, and it should be helpful for everybody involved, certainly for the citizens and then for the hospitals and doctors that, maybe they're getting ready to discharge a patient. They're not really sure if that patient's going to be able to follow up as been prescribed. They would make an appointment with one of us. We'd go out and meet with them and make sure that they're getting their medicines, taking them as needed, maybe do a dressing change, whatever the doctor would like for us to do. But just add that as something else that the fire department could do for the community. So.
And this really supports this program. I know that was a discussion that, these mental health, acute mental health crises, when we're called out, oftentimes it could just be an individual maybe that is not on their medicine for one reason or another. And it could be they didn't have access to it, they couldn't afford it. So this would even help prevent, hopefully, some of those emergent calls. So this fits right into what we're trying to do. Obviously, being reimbursed would be nice, but the more important thing here is we're able to provide these services, and the state is recognizing the mental health concerns of our communities. And we've been, for the last year and a half, we've been trying to put this program together. Now it seems like the state has been coming alongside, but I appreciate you making yourself aware of these resources as we bolster this program and get it kicked off. So
Yes, sir. I will say also, just to add to that, we've been slow getting started, and that has been on purpose. We've been asked to just take our time and make sure we're doing this the right way. We don't want to jump into something. But I will say that our numbers are climbing already to the point where we're just getting busier and busier. Last Friday, we went out on 5 different care situations. So far this month, I think we're at 18 by my count of CARES calls. The police department's been great dealing with us. We've made great relationships with the health department, with Bowen Center, with Fellowship Mission, and that list keeps growing because this is a community-based program. So all of those players are going to be very, very integral as we move forward with this.
And as you say, this is by design. We've been very purposeful with this program to not jump out too quick and not be prepared. And again, having these resources now is really going to support what we've been doing. But I applaud you and the chief, and the fire territory, our police department, Bowen Center, Sheriff's Department has been part of these conversations, and who am I forgetting?
There are a lot of players here. I've said it before, this community wants to help.
Yeah.
So we just have to make sure we're using those resources efficiently and effectively.
And we've also been utilizing a state group that puts these programs together in different communities. Mary Ann, what's the name of her group? Chief?
We're trying to get set up. Through NAMI so that it is a supported group. There's a conference going on today where they're talking about these very situations and how we deal with mental health response and what that looks like and crisis intervention techniques. So this is, I dare say, a hot topic right now that we are trying to address.
We started several years ago with a visit to another community in the state that had taken the lead on this and just knew this was an important thing. But as you suggest, there are many communities now, and we're not trying to invent the wheel or reinvent the wheel. We're really here to use best practices and now some state resources to make this program efficient for everybody. And again, the biggest benefactor is hopefully those folks that are suffering from many different mental health types of issues. So again, I applaud you for your work.
Thank you.
I know that's a lot of discussion, but George, do you have any questions on this mobile integrated healthcare? Is what we're kind of dealing with right now.
Actually, it all makes a lot of sense to me, and it sounds like you guys have done your due diligence and everything, so I applaud you for it.
So FSSA is the state agency that's providing, are they doing the certification?
The state is doing the certification.
State.
The state actually just added a branch, the state EMS
Oh,
commission.
state AMS, okay.
They added a branch to deal specifically with this because so many communities were starting their own programs.
Right.
And there was no regulation, there was no oversight. So
Got
the
it.
state has now said, this needs to be regulated. So it would be through them, but they are trying to work, and again, we're still figuring this out. So I mean, this is not something that's gonna happen tomorrow, but this is something that we have to progress towards. A lot of the state agencies that have been doing this for a little while already received from state grant money for this to get it started, to get it moving. South Bend's program, my understanding is rolling along pretty well. They went from one full-time person who was somewhat busy to now 2 full-time people, and they're very busy.
Got it.
So
So again, coming alongside FSSA and the fire and emergency medical services at the state, that's really the impetus here today to get the mobile integrated healthcare in our community. So, well, I've been a huge proponent of this, and I will make the motion that we approve this. George, any other thoughts?
No, I'll second it.
All right.
It's a good program.
Any further discussion? All in favor, say aye.
Aye.
Those opposed? All right. Thank you. Thank you for your work. All right. There are a few travel requests this morning. Jennifer's not with us this morning. There's one request approved by the Fire Territory Board for Chief Bollinger, and there are 2 requests for some leadership training in the police department. Any questions?
Now, I'll move to approve those.
All right. Any
Travel
further
requests.
discussion? All in favor, say aye. Aye. Those opposed? All right. Item 8. This is seeking permission to apply for a Kosciuszko County Community Foundation grant in the amount of $5,000. Larry?
Yeah, correct. We'd like to apply for that again. This is something that offsets some of the costs for our summer series concerts that we have at Central Park and Lucerne Park. It's not quite half, but it's close to half. We use Indiana Arts Commission grant funds and a little bit of budget funds for this series, but this helps greatly. We've had this grant for the past several years, and we'd like to continue to get it. So we'd like your permission to apply for it again.
Larry, how much is the Indiana Arts Commission portion of that?
It varies. It can be anywhere from $4,200 to $5,000 per year. It just depends.
Have we received that yet?
We've received part of it. It comes in two payments.
But we've been approved
Yes,
for it?
yes,
Yeah,
yes.
okay.
Yep.
All right. So between that and then these funds, if we're lucky to receive them, there could be a little bit that the Parks Department will have to
Yeah,
pick
they'll
up.
pay for about $10,000 of it, and we'll cover about $3,000
The
of the
balance.
whole series.
Okay,
So, yeah.
great.
Yep.
All right, that was my question.
All right. I'll move, we approve the application.
All right, I will second. Any further discussion? All in favor, say aye. Aye. Those opposed?
Thanks.
And item number 8, item 9 is the permission to apply for a REMC grant. This would be $1,500.
Yeah, this is, we've used this, we didn't get it last year, but the prior year we got it, and we used this for our family carnival event, and we'd like to apply for that again this year, trying to get that for next year's carnival.
So that event is also supported by other sponsorships as well?
Absolutely, yes.
Okay.
I'll move to approve the applying for it.
Permission to apply, great, thank you. I will second that. Any further discussion? All in favor, say aye. Aye, those opposed? I guess you can't first and second it, can you, George? All right.
All right.
Thanks,
Appreciate it.
Larry.
Thank you.
All right. Dustin, Street Department pay app for traffic signals at Center in Indiana.
This is also Center and Lake Street. This is just a pay application one for the project. This has been reviewed by our city engineer and his letter of approval in there as well for the amount of $363,813 on the first pay app. So the project is complete. We actually just received the bill for the second pay app yesterday, so that'll be coming down the pipeline in export orders.
Okay.
So. But the work has been completed. So.
All right, yeah, my error, it shows on our title that was Center in Indiana, but it is Center in Indiana and Center in Lake, so that's for both projects.
Correct.
Great.
I'll move we approve the pay app.
And I will second that. Further discussion? All in favor, say aye. Aye. Those opposed? Dustin, I just want to comment, this group did a far superior job coming in and getting this done in a timely fashion and doing a good job, and I appreciate all the assistance that you gave them and all your part in this work. So, again, it went pretty smoothly.
Yeah, I completely agree. They were phenomenal to work with, and when they came in, they didn't come in to screw around. I mean, they got the work done in they did both intersections in almost half the time of the first one that we had done. So
And it was
super.
There were no
happy.
wrecks, or it was all safe, and
Yeah.
yeah.
So,
All right, thank you.
thank you.
All right, stormwater reconstruction of Country Club Lane and the extension. Brian?
Yeah, we'd like to award this project to the G&G Hauling to complete this. This is down there, Country Club Lane, where we've had some flooding issues right there on the curve where it's extended out to the dead end, if you're familiar with the area. You can see the engineers have reviewed the bids and are recommending we award to HRP. Or, sorry, G&G. I was looking at
G&G.
the wrong one.
Yep.
The
Okay,
amount of $425,348.
yeah, let's be clear on that. It's G&G
It is
Hauling and
G&G.
Excavating.
I looked at the wrong one.
It's like we're trading back and forth there.
I know all the people out in that area are very happy to see, that's being addressed, and
Yeah, we think we
thank you for
can
you, Dustin. all the-
improve that quite a bit.
Yeah. that's-
I know in talking with James, the lake levels change with new dam structure and somewhat unavoidable. DNR project impacted the lake level just a little bit, and that's one of the things we had to contend with, and I appreciate you guys getting on that. So now that the bid has been awarded to G&G Hauling and Excavating,
Yes, G&G.
I'll ask for a motion to approve.
So moved.
I will second. Any further discussion? All in favor say aye. Aye. Those opposed? All right. And we'll move on. Another stormwater project, McKinley Street.
Yes, this is the project down there, kind of where Winona Lake is getting ready to do their roundabout. We have a 36-inch storm line that runs right next to a condominium there on Winona Lake. This project will relocate that outfall away from that condominium. This is a project that we've looked at doing for quite a while, but with Winona Lake wanting to do this roundabout, now is the time to do it so we don't have to tear up the roundabout at a later date. So that's what this project is for and why we are doing it now. So a little bit of a time, we need to get this completed before Winona's Lake project starts, probably April or so of next year. So that's what this project is for. Christopher Burke has provided their letter of recommendation for HRP to get this project.
So again, we're accepting and awarding that bid.
Yeah, we're going to award the bid, and then we're going to give the, notice to proceed for the next one.
Right.
How long will that roundabout take to, from start to finish, you think, to construct? Have they told you?
I don't know for sure. I don't have, they mentioned, they may have had some articles or something that I'm going to guess it's probably most of all of next year for construction. I think they would like to start somewhere in that April, May. Do you know for sure, Jeremy?
I'll guess in 4 or 6 months.
Yeah, I think,
It's just a roundabout, so it won't be as long as that.
Right.
You'll have to ask Craig Alaba for the details.
Yes, I understand.
We will stand by and assist them as necessary, but that's their
we
project.
just want to be out before they start so we can't be accused of having any conflict.
Yeah.
That's right. That's right.
But we appreciate working with the
Oh,
town on
yes,
this
they've been
project.
great to
This
work with.
be a win-win for everybody. I think I saw coming up on this project, there is like a grit separator on there. There's to help with
Yeah,
the,
we are going to do some water quality features on this one, trying to remove some of the grit and stuff prior to it getting in the lake. The land area we have to work with, we're not going to be able to protect against some of the bigger rain events, but your more common rain events, we should be able to help improve the water quality going into Winona Lake from the storm runoff.
so what we're asking now is to, for this Board of Works to accept the bid of $678,950 to HRP Construction.
So moved.
I'll second that. Further discussion? All in favor, say aye. Aye. Those opposed? And then item 13 is an agreement with HRP on the improvements. Brian, you want to talk about that?
Yes, this is just essentially signing the contract so they can begin work out there. Obviously, they're going to need to order parts, and it'll probably be, it won't start until probably February, March of '22, but this just gets the ball rolling. There's big delays right now in getting pipes and those sorts of things, so they need to get it ordered so they can have it on hand by the time construction season starts.
All right.
I'll move to approve the moving
Contract.
and signing the agreement.
All right, I will second that. Further discussion? All in favor, say aye.
Aye.
Aye. Those opposed? All right, no special claims, Lynn?
No special claims.
All right.
Oh, we
We missed one.
Oh, I did miss number 14,
Brian,
change order.
Yes, this is a change order for the plant expansion project. We had them install some alarm silencing buttons. We discovered once an alarm went off, there was no way to silence it, so you had to work on it the whole time with the alarm screaming in your ear. So we added these silencer buttons.
sounds prudent.
So this is the SCADA system at the plant?
At the plant.
Okay.
Yeah, once a local alarm went off, you couldn't silence it right there, so you had to work on it with the alarm going off the whole time.
Well, I'm sure you could have thought of something to silence.
Yeah.
Having big wrenches out there.
That makes sense to me. I'll move to approve that.
All right, I would second that. Any further discussion? All in favor, say aye. Those opposed?
Thank you.
Thanks, Brian, appreciate it. Claims docket has been presented. George, did you see anything?
I got a couple questions answered already, so I didn't see anything.
Neither did I.
So I'll move to approve the claims docket as presented.
All right, I will second that. Further discussion? All in favor, say aye.
Aye.
Those opposed? Travis, good morning.
Good morning, apologies for being late.
Well, we've already approved
We've already
it.
approved.
Okay, I was here to answer questions just in case, but
There was a little notation on here. about setting up after the farmer's market. The farmer's market probably isn't operational in April. It starts in May. So I assume you're
That was probably a carryover from our
shooting for
postponing.
a 1 o'clock road closure.
Yeah.
Yeah, and which is not a big deal. So, yes, we approve the road closure.
All right,
All right,
thank you.
thank you. All right, well, I think that's, anybody have anything else to add? Any items carried forward? Questions? All right, is there a motion to adjourn?
So moved.
All right, thanks, George.